The 10 or 20% of off-the-shelf implants that are unhappy with their implant or their surgery typically complain of pain that's kind of vague. Sometimes it's activity-related pain. Sometimes it's they can't perform activities that they really would like to do and the things that are important to them. And so that really kind of boils down to usually instability, that the knee is just not engineered to fit their normal kinematics and their normal ligaments and how those things work together and how their muscles pull on their knee is not the same as it was before the surgery, so the patient has limitations.
When we test the knee at the time of the operation, we typically test in essentially a straight knee or 0 degrees as well as a flexed knee to 90 degrees. We want to see that the stability and the balance is correct at those two positions. What we often underappreciate is what happens through that, what we call mid-flexion area. As the knee comes through into 45 degrees and beyond, what happens, because the ligaments and the anatomy does change at that point. One of the big problems that we've seen is that the knee can be balanced in those two positions but become very unstable in the mid-flexion zone. We also think that is part of the reason why people ultimately have problems after knee replacement is that what we call mid-flexion instability. As we look at a more patient-specific solution, if we can match that anatomy perfectly throughout the range of motion and not just in those two positions, then we really feel that we can eliminate that mid-flexion instability. We can eliminate those subtle problems that patients get afterwards. And those subtle problems can be swelling in the knee, pain in the knee, difficulty going up and down the stairs, which are common things that we see that we often underappreciate that are likely coming from mid-flexion instability. This solution, I think, addresses that because we're matching anatomy so well.
With the Conformis implant, because it provides a near exact reapproximation of the knee prior to becoming diseased, then the problem with mid-flexion instability is greatly minimized. And so, at least in the last year and a half, 2 years that I've been using this total knee replacement, I haven't seen mid-flexion instability as a problem with the iTotals as I have in other off-the-shelf designs. And that's something that's very exciting for me as a surgeon.
I'm not seeing the mid-flexion instability that we see with the off-the-shelf implants, and the main reason is with the off-the-shelf implants, you're cutting off the end of the femur and you're building up from that point, kind of recreating that patient's joint line. With Conformis, you're respecting that patient's femoral offset and you're maintaining a consistent arc of motion throughout the range of motion of that knee. You've got full contact with the inserts and the femoral component. That contact area between the components and the polys, the plastic inserts in between, remains consistent from full extension to mid-flexion to full flexion. We're not seeing that liftoff, if you will, or that gapping open in mid-flexion where you see with a lot of components because of that mismatch, I think, in the femoral condyle. You're not respecting the offset. As I said earlier, you're cutting off the end of the femur and then you're building up from there. So since you're preserving bone and you're preserving that arc of motion, you don't see that mid-flexion instability with Conformis at all.
I have had patients who've had a standard total knee replacement on one side and we've used the Conformis implant on the other side. And the difference is really the flexion angle, the ability to flex the knee better. And secondly, the difference from the standard knee replacement is the ability to have that stability in mid-range motion where they don't have that play on the other, that they have on the other side. So for example, a patient with a standard knee replacement that's sitting off the edge of a table, you can take their knee at mid-range and just kind of wobbles back and forth. It clicks because the metal and plastic are popping one another, versus the Conformis patient where that mid-range has full stability just like a normal patient would have, where there's no play at all. So it feels much more like a normal knee. And that's the difference. It just feels more normal because there's stability in mid-range and there's higher flexion.